I'm joined by Dr. Saswati Sinha, critical care specialist at a hospital in Kolkata. And Doctor, thank you for giving us some of your time. I know you're under a lot of pressure. Tell us what's happening in your hospital.
It's an unprecedented scenario in our hospital, and in fact, a lot of hospitals across the city and country. And we've never seen anything of this kind. The number of cases are soaring. People are frantically calling us for beds. Our critical care beds are completely occupied. We are running at 100% capacity. Our ward beds also are running short. On top of that, we are constantly being pressed by phone calls from relatives or patients who've been admitted under our care in the past, because they are desperate to get their next of kin into the hospital.
You sound, understandably, somewhat shell-shocked by this.
Absolutely. It's just overwhelming. We are completely feeling a sense of despair, and seeing the healthcare system totally crippled within a few weeks gives us a sense of desperation, a feeling of helplessness, not being able to help people who are reaching out to us.
What's the situation with oxygen? Are you managing?
Thankfully, we've not faced a shortage of oxygen so far, especially in our hospital yet or the other hospitals in the city. I'm talking about as of today. But the news across the country is very fearful.
What more or what immediately do you think the government could do to try to improve the situation?
See, I guess I think we as citizens also are, we should take the responsibility amongst ourselves. We should be able to restrict what we've been doing, actually crowding places, not following the COVID safety protocols, try to reduce getting to the gatherings. In fact, I think the onus lies upon the citizens first. That is the only thing which is there in our hands.
And how can you explain the fact that there have been such big crowds? I mean, whether you're talking about election rallies or social gatherings, do you think it just has taken a very long time to hit home?
Well, I guess so, because we started getting signals towards the beginning of April that the cases had started rising. Despite all the information being out in the open, I don't think we got our act together. None of us actually, I don't know whether we were wishing it away, but it was staring in our eyes. Each day, the number of cases were going up. So I think that was the time when if we could have taken some corrective measures, then I don't know whether we would have had faced this day.
And just a final thought, do you think a national lockdown would be going too far?
Well, a national lockdown is, I hope it is, we are not forced to have a national lockdown, because it has a lot of collateral effects on the other parts of the society. But we would just hope that there is some restriction, or the number of cases starts slowing down at least to some extent, so that the healthcare infrastructure can take care of what's going on. But if everything fails, unfortunately, probably we're headed in that direction.
Thank you again very much for your time here on BBC News, Dr. Sinha in Kolkata. Thank you.
Thank you so much. Thank you.